So next question I received was specifically about taking a certain essential oil and medications. Like, I had the list of medications, and I get this a lot because I'm a pharmacist, and there's not that many pharmacists that really spend a lot of time studying about essential oils and are adopting this lifestyle necessarily and leading at that level. And so I understand why I get a lot of these questions. But here's the thing that I want you to know on a broad level. If you're ever concerned about that, I would definitely refer you back to your doctor. It might sound like a standard response, but guys, I don't know what your medical history is. I don't know anything about you other than what you're telling me a lot of times. And so that's just not enough information. And so the thing is that if you go back to your doctor and you tell him what you're trying to do, and if he's not on board with you adopting a more natural lifestyle for whatever the reason might be, it might not even be specific to trying to get off a medication. It might just be, hey, I want to use more natural means to help support my body. If he's not on board with that, I kind of feel like that might be a clue for you. So just want to leave that there. But even if this doctor or this healthcare professional doesn't know a lot about essential oils, I feel that they still need to support you in whatever decision that you want to make and really guide you in with their best judgment how to continue on. So I just want to leave that there as just a blanket statement pretty much, and what I always like to encourage people to do. But here's the thing also, you know your body best, and you know what you need to do to take care of yourself and what you're wanting to do. And so that should guide you always. A doctor's opinion and knowledge are very, very much needed, and I respect that, and as you should as well, right? But the thing is, like I said, you know your body best, and so you know how you want to support it and what you want your future to look like. So just always keep that in mind. But in general, I will say that essential oils work very well with your body when you're on some type of prescription medication, because here's the thing, essential oils are always going to try to bring your body back to balance. And so when they're doing that, speaking about certain medications, it might help the medication work better. And so you might need a lower dose. There might be a few slight changes. That's, as a whole, there are no true interactions like you would think of a medication interacting with a medication. They don't work like that. They're helping to support your body, just like when you take in foods, right? That's helping to support your body and what it's already trying to do, come back to balance. And so in general, it just depends on if you're using them safely. I mean, hopefully you're using essential oil safely. Hopefully you're using a pure essential oil that you trust the quality of. That's very, very important. And so if that's the case, likely you're not going to have any issues. And obviously I can't say 100% certainty that I would never want to do that. But in general, if you're following those guidelines, you're not going to have any problems with this. So I just also want to encourage you to think about how you're using the essential oil. So if you're using it aromatically versus internally, you're going to get much less of the essential oil as far as a potency level than you would if you were taking it internally, and a lot of drops a day, right? And so you just have to kind of think and use your better judgment on that. But that's what I would say in those circumstances. And I think a lot of times if we use our intuition and if we use common sense, you're going to be fine. But obviously, if you're starting something new, talk to your physician. You know your body best. Listen to your body. If something's going awry, back off, stop, just like you would with anything. So hopefully that helps. And I'm so thankful for these questions every week that I get. I love answering you guys' questions. So if you have any questions at all, you can message me privately, and of course I'll keep your name anonymous. You can post, send me a message. You can post under a post if you have a question. I'll take them from wherever you want to give me the questions. But I come here every Tuesday, so join me next Tuesday if you guys want to see what questions I have or what topic I'm bringing. Also, you can, if you're on Facebook, you can scroll down and see the other posts that I've done on different topics. And if this information you think would help somebody, please share it out and give this to them so it will give them some extra information around whatever they're dealing with. So I will see you guys later. I hope you have a great Tuesday.